So hello friends, so in this video I am going to discuss about a pleural effusion. But before the pleural effusion, I am going to give you about the introduction of pleura. That is, what is pleura, and also what are the two layers of pleura, and here what is pleural cavity. So all these are the information or introduction of pleura. Now after that I am going to discuss that is what is the definition of pleural effusion, and after definition of pleural effusion I am going to discuss what are the symptoms of the pleural effusion and also what are the causes of the pleural effusion. And finally at the end I am going to discuss that is what does respiratory rate increase in the patient of pleural effusion. So please stay tuned and watch till the end. Now I am going to explain what is pleura, what are the layers of pleura, and what is pleural space. So friends, so please see this diagram. So in this diagram, the structure that is shown in pink color is the lung. Now here you can see that there is a double layered membrane, and that double layer membrane is the blue color layer and the orange color layer, and these two layers they together form the double layer membrane. Now here you can see that this double layer membrane, so here that is covers the lungs and also surrounds the lung completely, and that double layer membrane that covers and completely surrounds the lungs is known as pleura. Okay, so this is the definition of pleura. So friends, again please see this diagram. So now with the help of this diagram I am going to explain what are the layers of pleura. So if you can see, so you can relate that there are two layers of pleura, that is the visceral layer and the parietal layer. Now in this diagram the layer that is shown in the green color is the visceral layer, and also by seeing the diagram so you can relate that the visceral layer is the inner layer of pleura first thing, and next that this visceral layer is completely adhered to the lungs and also completely covers the lungs. So this is the definition of visceral layer. So the visceral layer of pleura is the inner layer of pleura, and then this visceral layer of pleura is completely adhered to the lungs and also completely covers the lungs. So this is the main definition of visceral pleura. Now please see this diagram, and with the help of this diagram I am going to explain about the parietal pleura. So friends, see that this parietal pleura is the outer layer of the pleura, and then this parietal pleura is attached to the chest wall, and also that this parietal layer of pleura does not adhere to the lung. So this is the main definition of parietal pleura, that is the outer layer of pleura that is attached to the chest wall or a thoracic wall, and then this outer layer of pleura is not adhere to the lungs. So this is the definition of parietal pleura. Okay, so visceral pleura and parietal pleura. Now I am going to explain what is parietal space, or now I am going to explain that is what is pleural space or pleural cavity. So friends, so please see this diagram. So if you see this diagram, so you can relate that there is a space or a cavity present between the parietal pleura and the visceral pleura, and that layer or and that space or cavity which is present between a visceral pleura and the parietal pleura is known as pleural space or pleural cavity. See about pleura. There is a definition of pleura, that is a double layered membrane that covers and surrounds the lungs completely, and that double layered membrane is known as pleura. So this is a definition of pleura. So now see that is the types of pleura. So here visceral pleura and the parietal pleura. Now the definition of visceral pleura, that is the inner layer of pleura that adheres completely to the lung surface, and also that is covers the lung completely, and that is known as visceral pleura. Now see that is the definition about the parietal pleura. So parietal pleura, the outer layer of pleura that is attached to the chest wall and it does not cover the lung completely, and this is known as the parietal pleura. Now you can see the definition of the pleural cavity. So here pleural cavity, that is the cavity or the space between the parietal pleura and the visceral pleura. is known as pleural cavity. So this is the main definition of the pleural cavity, and all these are the informations of pleura. So now I am going to explain what is pleural effusion, that is a definition of pleural effusion. So friends, see this diagram. So if you see that, so normally in the pleural space only little amount of fluid is not present. So simply remember that physiologically that in the pleural cavity or pleural space no fluid is present. Now again see this diagram. So this is a pathological condition where fluid accumulates within the pleural space or pleural cavity, and that accumulation of fluid within the pleural space or pleural cavity is known as pleural effusion. So now I'm going to explain you about definition of pleural effusion. So see, so here there is a definition of pleural effusion: the accumulation of fluid in the pleural cavity or a pleural space, and is known as pleural effusion. So this is the main definition of pleural effusion. So friends, now I am going to explain what are the symptoms of the pleural effusion. And the symptoms of the pleural effusion, the first one is the shortness of breath, second one is the cough, and the third one is the chest pain. So in this part I am going to explain the cause of each symptom in detail. So let's first discuss the cause of shortness of breath or dyspnea. So friends, please see this diagram. So if you see this diagram, so you can relate the function of lungs in a normal situation. That means when there is no disease and when there is no pleural effusion. So see that in a normal situation that the lungs and the chest wall, they are easily able to expand, and the diaphragm is also easily able to move down. So as a result, that is the required amount of space necessary for the oxygen to enter is available. So therefore that is inhalation and inspiration are done properly, and the required amount of air or oxygen enters in our body. So this is a normal situation. So simply that in a normal situation there is no fluid in the pleural space. So as a result, that is the lungs and the chest wall, they are easily able to expand, and the diaphragm also moves down. So due to this, inhalation and inspiration, they are done properly, and the required amount of oxygen is supplied to our body tissues. And also oxygen, that is a required amount of oxygen can enter in our body also. So this is a normal situation. Now again see, this is a situation of the pleural effusion. So see that in case of pleural effusion, that is due to the excess fluid in the pleural space, the expanding capacity of the lungs and the chest wall is reduced. As the lungs and chest wall, they are unable to expand. Now what happens is that the required amount of space which is necessary for the oxygen to enter in our body is not available. So in pleural effusion, that due to this, that is the inhalation and inspiration are affected. Why? Because that is lungs and chest wall, they are unable to expand properly. Now since inhalation and inspiration are affected, so therefore that is less oxygen enters in our body, and also since less oxygen enters our body, this leads to difficulty in breathing, and then this problem also leads to known as that is shortness of breath. So shortness of breath occurs because the lungs and the chest wall, they are unable to expand properly due to excess fluid in the pleural space, and as a result, that is the required amount of air necessary for the entry of oxygen in our body is not available. So therefore less oxygen enters in our body, so this leads to that is dyspnea. So this is the main cause of shortness of breath. Now I am going to explain the cause of cough. Now friends, again see this diagram. So if you see this diagram, so you can relate that in case of pleural effusion, due to excess fluid in the pleural space, the compression or the collapsation of the lungs happens. So therefore that is the lungs are infected or they are compressed. So therefore that, and in response to this compression of the lungs, that is cough occurs as a reflex action. So therefore that is the main cause of cough is that the compression of lungs or the collapsation of lungs, and all this, so here that is problems that is cause cough as a reflex action. So this is the main cause of cough. Now I will discuss the cause of breathing. Now friends, as you have already understood that in case of pleural effusion, that is the lungs and the chest wall, they are unable to expand properly. Now, so as a result, that is less amount of oxygen enters in our body, so this leads to dyspnea. Now, since less amount of oxygen enters in our body, so this also supplies, so here that is less amount of oxygen to our body, so here body cells and tissues, so this gives a negative regulatory signal, that is to increase the work of breathing. Now, so therefore that is, in this case, that is the work of breathing is increased. And also see that is due to compression of the lungs, that is the parietal pleura is also affected. Now, due to infection of the parietal pleura, that is the chest wall that is in contact with the parietal pleura is also affected. So as a result, that in the chest wall, that is infection, inflammation and pain, all these things are caused. Now, since that is the chest wall, they have to expand, that is forcefully in spite of being infected and inflamed, so therefore that is chest pain occurs. The main cause of chest pain is that the increased work of breathing, and also that is the infection, inflammation and pain in the chest wall. So this is the main cause of the chest pain. Now about the symptoms of pleural effusion, the first one is a dyspnea or the shortness of breath. So see that normal situation. So normally there is no fluid in the pleural cavity, as already know. So during inspiration, the lungs and the chest cavity, they are easily able to expand perfectly, and also diaphragm moves down. So therefore in this case, inhalation and inspiration are done properly, and the required amount of oxygen enters our body. So this is a normal situation. But now I will discuss about a pleural effusion case. So in pleural effusion, so here excess fluid accumulates in the pleural cavity. So during inspiration, the lungs and the chest wall are unable to expand perfectly. So therefore inhalation is not done properly, and the required amount of oxygen is unable to enter our body, and this leads to a condition known as dyspnea or shortness of breath. So now see about the cough. So see that in pleural effusion, the compression or collapsing of the lungs happens, so due to the excess fluid in the pleural space. So in response to this compression and collapsing of the lungs, so here that is cough occurs as a reflex. So this is the main cause of cough. Now I am going to explain that is the what is the cause of chest pain. So as already noted, in pleural effusion, due to excess fluid in the pleural space, the parietal pleura undergoes infection. So since the chest wall attached the parietal pleura undergoes infection and inflammation and pain, so due to this also chest pain occurs, because this chest wall have to do forceful breathing in spite of the infection also. So this is the main reason. So therefore that is the chest pain occurs during breathing. The main reason is that the infection of this chest wall. Now I am going to explain that is why does respiratory rate increase in pleural effusion. Now friends, you should know that this respiratory rate, so here that is different for children and adults. So here differs upon age. Now in this case, the patient that I took is the 8-year-old boy. So and in this case, that is the normal respiratory rate range is, so here 16 to 30 beats per minute. But now in my case, that is the respiratory rate of patient is, that is 54 beats per minute. So now I am going to explain the reason for this. Now, so friends, as you already understood that in a pleural effusion, that is the lungs and the chest wall, they are unable to expand properly. Now, so as a result, what happens is that the inhalation and inspiration are affected. Now, so due to this, that is less oxygen enters in our body, and also less oxygen supplied to our tissues. Now, since less oxygen supplied to our tissues, and this leads to a, that is hypoxic condition, and this hypoxic condition, that is gives a negative regulatory signal to our body, that is to increase the work of breathing. Now, so due to the increased work of breathing, that is the respiratory rate automatically increases. So therefore that is the main cause of respiratory rate is the hypoxia. and this hypoxia is done as the inhalation and inspiration are affected, and this hypoxia that is gives a negative regulatory signal to our body, that is to increase the work of breathing, and it increase in the work of breathing, automatically respiratory rate increases. So this is the main cause of the increase of respiratory rate in pleural effusion. Now that is that is why it does, that is RR, that is a respiratory rate increase in pleural effusion. So see that, answer that in pleural effusion the fluid accumulates in the pleural space. So due to this the expanding capacity of the lungs and the chest wall decrease or reduce. So therefore less oxygen inhaled during inspiration as inspiration is affected. So therefore less oxygen supply to tissue. So therefore hypoxia occurs, and this leads to a negative regulatory signal to our body, and on that basis the breathing work increases, and due to this RR, that is a respiratory rate increases.